I'm involved in a lot of people's lives, and health is definitely a reoccurring theme for people receiving support. Health isn't just seen in isolation. There's many different bits to being healthy. So with that psychological background that I have, I'm able to have those conversations with the person around how's their day going, what sits behind some of those decisions that a person makes when they decide to engage in whatever behaviour they're wanting to engage in. Is that the person's in the driving seat in terms of how they're wanting their support structured, and I'm right up alongside them, working with them to shape their support in ways that they're really wanting it to be going. It's also health from an emotional point of view. You know, it's about taking responsibility for your own happiness and your own well-being. What inspired me to the role was the number of people that I have the privilege of being able to work with. Health is obviously something that gets a lot of talking about, a lot of discussion. And what I find is that I know that it's different for me, it's different for you, it would be different for someone that I'm supporting. So the first thing I need to do when I'm finding out what does a healthy day look like to you is ask them the question. You know, I have to ask them, what does it look like? What do they need to put in place to be able to make sure that they can get through the day as best as they could. It's also, you never know what situation you're going to be in. But there's been some people that we support who never intended on receiving support in their lives, and this is now the situation that they're in. So I always try to keep hold of how would I like to receive support, and I think that really pitches, that really determines how I respond and how I act. I'm Shirlaw. I'm a service coordinator at Geneva.